So much. Well, the holidays are full of comfort foods, but not everyone can handle the dishes. For those impacted by acid reflux, I'm here now with MedStar Health's Dr. Angelica Nocerino. Thank you so much for joining us.
Good morning.
This is so important.
Yes.
We'll get into the treatment options and everything else, but I want to begin with those who may not be familiar with acid reflux or think they know and truly have no idea.
Right.
So what is it?
So acid, it's normal actually to have it in your stomach, right? We need acid in our stomach to digest food, to absorb certain vitamins and minerals. The problem is when acid moves from the stomach into our esophagus or our food pipe, that can cause a burning sensation known as heartburn because it's in the wrong spot. In addition to just the burning sensation, sometimes symptoms can be vague. You can have like a sour taste in your mouth, nausea, and in some people, regurgitation, feeling like the food's coming up. Even chronic cough and throat irritation can be signs of acid reflux.
I remember a few years ago when I shared this with my producers when we were talking about you coming in, I kept having laryngitis over and over, and finally an ENT go, you know what, I think you're dealing with acid reflux, but it's deeper than, you don't feel it in some of those other symptoms you just described, but laryngitis can also be a symptom.
Exactly, the throat irritation, the chronic cough, because the acid's moving all the way up your esophagus to the back of your throat.
So what are some foods we should avoid?
Yeah, so the biggest thing with acid reflux is that at the end of your esophagus, you have what's called a lower esophageal sphincter, which think of it as like a valve to protect reflux moving from your stomach into your esophagus. So sometimes there are certain foods that can make that sphincter relax or open inappropriately or weaken it, causing reflux. So overeating, right? Holidays. There's temptation everywhere. We're eating holiday snacks, festive drinks everywhere. So if our stomach is full of pressure and distended, that's going to cause reflux. Then there's certain foods that weaken that sphincter. So chocolate, spicy food.
All the good stuff.
All the good stuff. Alcohol, you know, tomato-based foods. Those are notorious for causing
caffeine
acid.
too, I hear.
Coffee as well, Everyone can have different triggers, but those are the most common ones that can cause it.
Okay, so along with avoiding those foods, if you feel the triggers coming on, what are some things that we can take to monitor everything?
Yeah, so a lot of this is over-the-counter. Some are prescription. So you have things like Gaviscon or Tums. So what you're taking really depends on your severity of your symptoms and the frequency. So you can take things like this to quickly neutralize the acid in your stomach. So you're at that holiday party, you're drinking that red wine, you have symptoms right now and you need symptom relief, you can take Tums and it'll work pretty quickly. But it won't last the whole day. So it's just quick onset and quick offset as well.
You made me think of something. So what if you're being bad? You can't avoid the chocolate or whatnot. Can you take some of these medications before?
Absolutely. Preventative we're talking about. Yep. So Pepcid is preventative. So Pepcid is a H2 blocker, so prevents acid production. So this takes about maybe 30 minutes or an hour to kick in, but say you know you're going to go out and eat that pizza or that pasta that causes reflux, pop a Pepcid right before dinner to help prevent the acid reflux. And this again is preventative, and if you're having occasional symptoms, maybe once or twice a week, you can take something like a Pepcid. But if you're having more severe symptoms every day, or you're taking Pepcid, you're taking Tums, symptoms aren't getting better, you need more long-acting protection. Something like a proton pump inhibitor or a Nexium is going to give you long-acting acid control. But with this, it takes a little bit of while to kick in, right? So Tums is really fast to get a relief. This you have to be taking every day consistently to see a long-acting 24-hour protection.
So it goes in this order.
Exactly, in this order. Yep.
Wow. So what about other things, maybe surgery? I know that could be extreme, but if it is an extreme case of acid reflux, that might be the necessary option.
Yeah, absolutely. It's always important to talk to your doctor about that. It's really important to try diet, lifestyle modifications, try these medicines, but if your symptoms aren't getting better, really impacting your life, there is a surgery called fundoplication where they actually wrap the top of your esophagus around that sphincter to tighten it, to prevent reflux.
That was one of the things that were actually prescribed for me, but I changed my diet and I haven't had that issue before. Sometimes you just have to stick to what the doctor is telling you to do and things will feel better. Thank you so much, Dr. Nocerino. We appreciate you and all of your tips. They were great ones. And that's where you can follow and keep up with MedStarHealth.org for all of your healthcare needs.